After enough years in dentistry, you realize something important: the most technically demanding part of the job is not always what happens inside a patient's mouth. Sometimes managing people is much harder. You can have a perfectly organized schedule, excellent equipment, and outstanding clinical skills, but one person with a difficult communication style can change the atmosphere of the entire dental practice. It may be an employee, a colleague, a business associate, or even a patient. These people are not necessarily bad people. The problem is usually a pattern of behavior that frustrates others, slows down the work, or creates conflict. In a dental team, these patterns become especially noticeable because people work closely together, under time pressure, with very little room for mistakes. Over the course of a professional career, we can recognize 10 common types of difficult personalities. Of course, real people are far more complex than these categories, and no one should be reduced to a simple label. But recognizing a behavioral pattern can help us respond more rationally instead of emotionally. Number 1, the tank, the person who attacks. You recognize this personality almost immediately. They speak loudly, interrupt others, behave aggressively, and try to control the conversation. When there is a problem, they do not discuss it, they attack. In a dental practice, this might be a team member who reacts aggressively to criticism or a patient who raises their voice at the front desk and demands that everything be solved immediately. The worst response is to become even more aggressive. If you fight fire with fire, the conversation quickly turns into a battle of egos. A much better approach is to acknowledge that the person is angry, remain calm, and start asking specific questions. I understand that you're very upset. Tell me exactly what happened. When you ask an aggressive person specific questions, the conversation gradually moves away from emotion and toward facts. Then try to involve the person in finding a solution. What would be an acceptable solution for you? But there must be a clear boundary. Understanding someone's frustration does not mean tolerating insults, threats, or unacceptable behavior. Number 2, the sniper, the person who attacks from the shadows. This is a different type of problem. The sniper rarely attacks directly. Their weapons are sarcastic comments, mocking remarks, eye-rolling, and short sentences designed to make you look foolish in front of others. In a dental team, it might sound harmless: of course we're staying late again. As usual. Or, the doctor obviously has plenty of time today. The problem is that repeated sarcasm slowly destroys mutual respect. If the comment is harmless, sometimes the best response is to ignore it. But if the pattern continues, respond directly. Do not retaliate with humiliation. Say, I've noticed that comments like this keep coming up. If there is a problem, I would rather you tell me directly. This does something very important: it brings the conflict out of the shadows and puts it on the table. Sarcasm loses much of its power when the person has to openly explain what they are actually trying to achieve. Number 3, the know-it-all, the person who is always right. Almost every dental practice can have someone who seems to know the answer to every question. The problem is not knowledge. Knowledge should be valued. The problem begins when someone cannot accept the possibility that they might be wrong. They struggle with correction, interrupt others, and often speak with great confidence even when the facts are not completely clear. If something goes wrong, they may explain with the same confidence who is to blame. Do not try to defeat this person in a public intellectual contest. If you humiliate them in front of the team, you will probably only increase their resistance. Bring the conversation back to facts. What are you basing that conclusion on? Let's check the procedure. What information do we actually have? The goal is not to prove that you are smarter. The goal is to make the right decision. In difficult discussions, it is often useful to change the objective from "I have to prove that I'm right" to "we have to understand the problem and reach the best solution." Number 4, the think they know it all, the person who wants to look like an expert. This type can be even more complicated. The know-it-all may genuinely know a great deal. The think they know it all wants other people to believe they know a great deal. This person speaks confidently, gives an opinion on everything, and often tries to attract attention. In healthcare, this can be especially dangerous because confidence is not the same as competence. Do not enter into a status competition. Ask for specifics. Show me how you would do that. What is the protocol? What are we basing that decision on? Once the conversation moves from impressions to facts, the person's actual level of knowledge becomes much clearer. In dentistry, it is far better to have someone say, "I don't know, but I'll check," than someone who gives the wrong answer simply because they are afraid to admit they do not know. Number 5, the grenade, the person who explodes. The grenade may appear completely normal and then suddenly explode. The reaction is often far greater than the original problem. A small scheduling mistake can trigger a list of complaints going back 6 months. The same thing happened last month. Nobody listens to anyone here. I always have to do everything. The biggest mistake is trying to solve 10 different problems while the person is still emotionally overwhelmed. First, lower the temperature of the conversation. Do not interrupt aggressively. Do not respond by shouting. Listen long enough for the person to feel that the issue has been acknowledged, then ask questions that bring the conversation back to the specific event. I understand that several things are frustrating you. Let's first deal with what happened today. Staying calm is not being passive. Staying calm allows you to maintain control of the conversation. Number 6, the yes person, the person who says yes to everything. At first, this may look like the ideal employee. Sure. No problem. I'll do it. But the problem begins when the person accepts more responsibilities than they can realistically complete. They want to please everyone, avoid conflict, and find it difficult to say no. After a while, tasks start being delayed, promises are forgotten, and the person becomes frustrated because they feel everyone is demanding something from them. Do not give them 10 more tasks simply because they never refuse. Ask about priorities. What is currently on your list? What can you realistically finish today? If you take this on, what should we postpone? A good manager does not measure reliability by how often an employee says yes, but by how many commitments they actually complete properly and on time. Number 7, the maybe person, the chronic decision delayer. We'll see. I'll think about it. Maybe. I'll let you know. The problem is that many decisions in a dental practice have deadlines. Are we ordering the material? Are we changing the schedule? Who is taking the patient? Are we servicing the equipment now or next week? The maybe person delays decisions in the hope that a better option will appear. Eventually, time makes the decision for them. Another 20 minutes of discussion usually does not help. Help the person narrow the choice. We have option A and option B. Which one do you choose? Then set a deadline. I need the decision by 2 o'clock. Do not demand the perfect decision when what you really need is a good enough decision made on time. Number 8, the nothing person. The person you cannot get an answer from. This is the person who sits in a meeting and says almost nothing. What do you think? Either way. Is there a problem? No comment. No initiative. Sometimes even their body language gives you very little information. The mistake is filling every silence for them. Ask a specific question and wait. Do not ask, "Do you have anything to add?" Ask, "What is one thing you would change about the way we organize patients in the morning?" Then stay quiet. Some people simply need more time to formulate an answer. If the manager always rescues them after 2 seconds of silence, they learn that they never really have to contribute. Number 9, the no person, the person who kills every idea. It won't work. We tried that. Patients won't accept it. We don't have time. That's impossible. This person can become a brake on the entire team. Every new idea is met with a reason why it will fail. That attitude can quickly destroy other people's energy. But there is an important trap here. Do not automatically assume that everyone who says no is difficult. Sometimes the skeptic is the person who sees a risk that everyone else is ignoring. So ask, what specifically is the biggest problem you see? Then add, how could we solve that problem? If someone constantly identifies problems, ask them to participate in creating solutions as well. Criticism without an alternative quickly becomes nothing more than negativity. Number 10, the winner, the person for whom nothing is ever good enough. The winner always has a problem. The schedule is bad. The patients are difficult. Colleagues are not responsible enough. The material is poor. The software is slow. The day is too long. What often characterizes this personality is the feeling that the world is unfair and that they are powerless to change anything. Their standards may be very high, but no solution ever seems good enough. If you comfort them every time or solve every problem for them, you may unintentionally reinforce the same behavior. So after listening to the complaint, ask another question, what do you suggest we do? If the answer is, I don't know, continue, think about it and give me 2 possible options. This moves the person from the position of victim to the position of participant. After many years of working with people, one thing becomes clear, there is no single technique that solves every difficult relationship. With an aggressive person, you need to remain calm. With a sarcastic person, you need to set boundaries. With someone who knows everything, you need to bring the conversation back to facts. With someone who says yes to everything, you need to check their actual capacity. With an indecisive person, you need to set a deadline. With a silent person, you need to learn to tolerate silence. With a negative person, you need to ask for solutions. And with someone who constantly complains, you need to return part of the responsibility for solving the problem to them. But there is one rule that applies to almost all of them: do not try to defeat the person, try to solve the problem. Difficult conversations work best when you start with facts, maintain respect, explain the problem clearly, listen to the other side, and end with a specific question about the next step. They usually fail when we start the conversation angry, use hidden messages, suddenly attack the person, or try to shift responsibility onto someone else. And there is one more uncomfortable possibility that every dentist who manages people should occasionally consider. The person we describe as difficult may not be the only problem. Sometimes we need to ask ourselves why a particular person provokes us so much. Does their communication style remind us of something we dislike about ourselves? Do we struggle to accept criticism? Do we expect everyone to think like us? Do we interpret every disagreement as disobedience? Difficult people can sometimes be very uncomfortable mirrors. That is why the goal of a good leader in a dental practice is not to create a team where everyone agrees and everyone has the same personality. Such a team probably does not exist. The goal is to create an environment where different people can work together professionally, where disagreement can be expressed without humiliation, where aggression has clear boundaries, and where problematic behavior does not become an accepted part of the practice culture. Because in the end, the biggest problem is not that you will meet difficult people during your career. You definitely will. The real question is this: will you allow their behavior to control your dental practice, or will you learn how to manage the situation?